Lesson 11. Applying acupressure to treat periarthritis of the shoulder. Periarthritis of the shoulder is characterized by a sensation of intense pain at one or more points around the shoulder joint, accompanied by restricted movement of the shoulder and arm. The causes of periarthritis of the shoulder may include degeneration due to aging or injuries that lead to damage of the tissues surrounding the shoulder joint, such as ligaments, tendons, muscles, synovial membrane, and joint capsule, after excluding cartilage, bone injuries, or infections. First, we use a herbal pillow to apply warm compresses to the shoulder and scapula on the affected side. Before pressing the acupoints, we need to disinfect and warm our hands. We only need the following 5 acupoints. The first is Janjing point. The Janjing point is a large depression located on the shoulder between the clavicle and the acromion, identified by drawing a straight line upward from the nipple. The Janjing point belongs to the gallbladder meridian. When pressing the Janjing point, the therapist or the patient's family member uses their thumb to press, while the patient can use the middle finger of the opposite hand to place on the acupoint, massage and press at the spot, directing the force downward toward the leg. The Janjing point is effective for treating neck, shoulder and nape pain, shoulder and back pain, acute torticollis, mastitis, and helps make the chest fuller. Second is the Janu point. The Janu point is located at the shoulder corner and belongs to the large intestine meridian. To locate the Janu point, extend your arm horizontally. A depression will appear above the shoulder joint, that is the location of Janu. The therapist or the patient's family member uses their thumb to press and massage the point. As for the patient, they can use the middle finger of the opposite hand, massage and press at the spot with the pressure applied perpendicularly and slightly angled toward the shoulder blade. The Janu point is effective for treating shoulder pain, arm pain, shoulder joint issues, and stiffness or pain in the neck and nape. The third point is Yunmen. The Yunmen point is a depression located just below the clavicle between the pectoralis major and the deltoid muscle. Yunmen belongs to the lung meridian. When pressing the Yunmen point, use your index or middle finger, place your hand on the point, and apply pressure perpendicular to the chest. The Yunmen point is effective for treating chest fullness, coughing, asthma, shoulder pain, and periarthritis of the shoulder. The fourth point is Tianzong. The Tianzong point is the depression on the scapula. To locate Tianzong, find the intersection of the line connecting Jianjing to the base of the scapula and the line connecting Jianjing to Gaohang. To learn how to locate Janjang, Janjing, and Gaohang, please refer to the book Tips for Remembering Acupoints in the section on acupoints of the shoulder, neck, and back region. The Tianzong point belongs to the small intestine meridian. When pressing Tianzong, use your thumb to place on the acupoint, massage, and press at the spot, directing the force toward the nipple. The Tianzong point is effective in treating joint pain, numbness and fatigue in the shoulder area, neck and shoulder pain, numbness in the arm, and periarthritis of the shoulder. Fifth is the Ruzu point. The Ruzu point is located in the soft flesh beneath the shoulder. To locate it, find the intersection of the line extending from the armpit crease with the depression below the scapular spine. Ruzu belongs to the small intestine meridian. When pressing the Ruzu point, the therapist or the patient's family member uses their thumb to apply pressure, while the patient uses the middle finger of the opposite hand to place on the acupoint and massage it in place, pressing toward the shoulder joint. The Ruzu point is effective for treating shoulder joint pain, periarthritis of the shoulder, numbness and pain in the shoulder and arm, and hemiplegia. For each acupoint, we gradually press and hold and massage for 10 seconds, then slowly release and repeat 10 times. Practice this regularly every day. It is important to note that when treating periarthritis of the shoulder, you should not apply heat if there are signs of acute inflammation such as swelling, warmth, redness, or pain.